Okay, so examination of the anus, what all will you do? Going by the routine, inspection, palpation. There's nothing to percuss or auscultate here, so it's only inspection and palpation. What do you inspect? You look for any scars, you look for any discharging sinuses. You have to look for soiling of their underclothes. Okay, then you also have to look for, you ask them to squeeze and strain. When you strain, the pelvic descent should be less than 4 centimeters. That should be looked for. The skin around, if any warts are present, if any fistula is opening are present, all of this can be inspected. Okay. External hemorrhoids that can be seen. Internal, you may not be able to. A comprehensive examination. So if in your symptom complex, if even incontinence is a part of that, you have to do an example that as well. Okay, you can have to do an anal wink reflex. So what do you mean by anal wink? Take a wisp of cotton and you just strike it from lateral to medial. You can see the contraction of the skin as well as the anus. So that is present, which means the innervation to the sphincter is normal. So if fecal incontinence is present for the patient, you have to rule out if there is an anal wink or not. Bowel habits, ask the patient about normal routine, recent changes. Sexual history also, intercourse should be asked for. Family history, colorectal cancer, polyps, IBD. Patient often delays seeking care due to fear or embarrassment. So it's only on your asking questions and examining the patient that you'll be able to elicit a good history findings. So observe anal drainage, past the stool, evidence of any incontinence, generally retract the buttocks and see if there's any asymmetry, gaping, or the scars as well. You ask the patient to squeeze. So anal sphincter movement can be seen when you squeeze. Similarly, strain. So straining, if it's less than 4 centimeters, it's normal. And observe for any prolapse. Rectal prolapse is when you ask them to strain. So if the patient gives a history of rectal prolapse, and even on straining also, it's not coming down, you might have to ask them to go and sit in the restroom, the washroom, and then ask them to strain because they are best comfortable there. Only then can you see the mucosal prolapse coming out. Inspect the surrounding areas like buttocks, inguinal areas for infection. Like below the dendrite line, it's the inguinal lymph nodes which get involved. Above the dendrite line is the internal iliac. That you can see, but below it's always the inguinal lymph nodes. And so inguinal lymph node examination is also very important in such patients. Palpation, what do you